And also one of your videos came on YouTube, sir, when you said that INIS is a more predictable exam, it's a more easier exam to give. So that really motivated me to prepare for this, sir. And then I would like to thank the entire speed team, the entire faculty, sir, especially you, sir, uh, for very high yielding general surgery classes, sir.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Inzamam ul Hoda for scoring a topmost rank of AML rank 12 and CML 17 in NEET session of November 2025 in Speciality, Super Speciality of MCH Surgical Gastroenterology. Congratulations to you and best wishes to you.
Thank you, sir.
And great to have you in this session. And after your successful achievement in your super specialty of SGE, can you share your brief background from where you started till date, what all you have done?
Yes, sir. So I belong to Patna, Bihar, sir. I've done my MBBS from NMCH Bihar, NMCH Patna. I did my MS General Surgery from IMS BHU Varanasi, sir. Then I was doing my senior residency at Safdarjung Hospital, New Delhi, sir. And then I started preparing for the INISS after the previous NEET, sir.
Okay, excellent. Why is surgical gastro?
The surgical gastro, sir, because during our general surgery residency, sir, most of the cases that we do in our elective surgery, elective OT and also the emergency OT, most of these are GI surgery cases, sir. And also, I was posted in most of the super specialty department during my general surgery residency. So I was able to rule out those department and come to the conclusion that GI surgery is the field of my interest, sir.
Great. So the exposure, you mean to say the more exposure was for surgical gastro?
Yes,
And
sir. Yes, sir.
correct. Now, when once you decided to do, can you tell us your preparation strategy? What all you did when you started to achieve this topmost rank?
So basically, I started after the last NEET assess, sir. I got a rank of 257, but I did not take any seat, sir.
Why?
Uh, so I did not take any seat because I was not getting a good institute, sir. And also, one of your videos came on YouTube, sir, when you said that INIS is a more predictable exam, it's a more easier exam to give. So that really motivated me to prepare for this, sir.
Very good. Very nice.
And so initially my strategy was to first finish the general surgery part, sir. So for that, I started reading Bailey and Sebastian, and side by side, I was also watching your videos and also the video lectures of other specialities, sir. The live lectures, basically. And
Okay.
then after finishing that, sir, I started preparing for the GI surgery part. So for that, sir, I watched the Basan sir lecture, sir, and I also started reading Shackelford and a little bit of Bloomgard, sir, the topics that are repeated every year. So that was the strategy, sir.
Excellent.
And after 2 months prior to exams, sir, I started revising all those topics about the general surgery and GI surgery, sir.
Very good. Very good. So, how many questions did you attend this exam?
So I attended 77 questions, sir.
Excellent. Now, can you tell us what is your message to the juniors who are aspiring for SG, MCH?
My message would be that SD is the most sought out branch, sir, and it is little difficult in comparison to other specialties, sir. But we should not lose hope. If we try, sir, we can definitely get the seat of our choice, sir.
Okay. Now, can you tell us more on your preparation? Did you, go through Shackelford and Bloom-Gott? What is that kind of you did? What was the questions? Where are the areas you was asked?
So basically, first I started watching Basansa lecture, and from that we get an idea of what are the important topics that are repeated in each section, and so that we can just read those topics from Shackelford and Bloomgard, sir. Uh, Basically, Bloomgard, we have to be very selective in reading Bloomgard, sir, because it's a very vast book and we cannot cover the entire Bloomgard. Shackelford we can do, sir, 80-90% we can do, but Bloomgard is difficult to cover, so we should focus on the topics that are repeated in every session, sir.
Excellent. So, how you got into speed? How you chose speed as your partner to preparation for this SG exam?
Sir, I got to know about speed by my friends also, by YouTube also, sir. And they said that it is the best platform to prepare for, especially the surgical gastro in the super specialty examinations, sir, for the NISS.
So, did it prove to be right?
Yes, sir. It was very helpful, sir.
Okay. So, how many GTs would have given for this exam?
Sir, totally, I think I've given 12 GTs, sir.
Okay. So,
in the past 6 months.
yeah. So, what was, can you share something on your interview? I mean, what was the orientation of interview? How did you prepare for interview? What did they ask? I mean, can you tell us? Because you have scored from 17 to 12 to AML. So there was a
Yes,
shift
sir.
because of that. So can you share
Yes,
some?
sir. So actually, the interview is divided into two parts, sir. First is the spotter, and the second is the clinical viva, sir. In the spotters, five questions were asked, and I was able to answer four of them. And then was the viva, sir.
What was the area they were asking?
Sir, they were asking, one is the specimen, sir. One is the instrument. They also focus on biostats, sir. And one was the ABG question.
Okay.
Yes, sir.
Okay. Now it's time to thank
And
and
one was the intro picture, sir, that they asked.
it's time to thank and whom all you want to thank. You felt they helped you to reach where you are today.
Sir, first of all, I would like to thank Almighty Allah. I would like to thank my parents, sir, for supporting me during the entire phase. And then I would like to thank the entire speed team, the entire faculty, sir, especially you, sir, uh, for very high yielding general surgery classes, sir. So I would like to say that I decided that 2 months prior to exam, I made sure that before sleeping, I'd watch two videos of yours
Wow.
before sleeping. So I was able to complete most of your lectures like that, sir.
Okay. So was it
And
useful
I'd
for you?
like, yes, sir.
Was it useful for you?
Yeah, very useful, sir. Very useful, sir. Your one question is equal to 10 questions. Sir. When you discuss one question, that is equal to 10 questions at least. And so then I would like to thank Dr. Basant, sir, and also Dr. Ravin, sir, for his very high yielding classes during the last part, sir. And sir, I'd like to specially mention Dr. Hamza, sir. He was the topper in the last session, sir. He has really helped me during my entire journey, sir.
It's great that you acknowledge all of them.
Yes,
And
sir.
because people have become successful and the kind of gratitude that you have shown to God and also to people who helped you really means a lot. And we wish you once again all the very best and all the success for a very, very wonderful and a great journey in the field of surgical gastro. Best wishes to you, doctor.
Thank you so much, sir. Thank you, sir.